Good afternoon, how are y'all doing? It's great to be back here in McAllen in the Rio Grande Valley. I'm, of course, Joaquin Castro, and I'm proud to represent my hometown of San Antonio.
Yeah, go Spurs!
But my wife, Anna, graduated from Mission High School and grew up in Alton. And my father-in-law, Fernando, is here in the back and joined me today. Her family, of course, still lives in McAllen, so Anna and I are here every year to visit all the time. And so it's great to be back, y'all. I wanted to come today because we're in especially what I would consider a perilous moment in American history and American politics and policy. This is my 23rd year of public service, and I can tell you that this is the most intense time that I've ever had as a policymaker, and the most fear and anxiety that I have sensed among people in every socioeconomic strata. Business owners who are concerned about what tariffs are doing to their businesses, our seniors that are concerned about losing Social Security and Medicaid and Medicare, veterans who fought for our country that are worried about what the layoffs at the VA mean for their care. So many people in our country right now are hurting. And it's not just about potential cuts that may be coming to things like Medicaid. There are millions of Texans that use Medicaid today. Many of those in the Rio Grande Valley. It's not just about those cuts, but it's also about the rising prices that you see at the grocery store.
Yes, sir.
It's about the inflation that was promised to go down, but has continued to go up.
That's right.
All of these things are making it tougher for Americans, for Texans, for people in McAllen and throughout the state, making it harder for them to survive. So I wanted to come down here to say that there are folks in Washington, D.C. in Congress who are listening to you, who want to hear what you have to say. That everybody in Congress should be listening to their constituents and to Americans all over our country, because your voices matter. And I hope that as we talk today, but also when you leave today, that you will do me one favor, that you all will share your personal stories about how these things matter to you in your own lives and into your family's lives. Because when they talk about cutting Medicaid, for example, that's not just a budget line on a piece of paper in a budget in an office in Washington, D.C. in the Capitol. Those are real people's lives who may suffer. So please, y'all, tell your stories about how these services or programs or things have helped you in your life. And I want to give you a quick example for me, one thing that has been important to me. There are times in my life where I didn't have health care coverage at all, where I was uninsured and my family was uninsured. And at that time, if I had been in a bad accident or something unfortunate had happened to me, then my family and I, we would have gone broke. We had no insurance. Well, a few years ago in 2022, the summer of 2022, I was chairing a conference and I was in Spain. And we were coming back on the last night of the conference, and we were on a dark road. I was in the passenger side of the car, and we were going, I think the driver was going 65 or 70 miles an hour on what seemed like kind of a rural road, and the car hit a wild boar going 65 or 70 miles an hour. Now, if you've ever hit an animal on the road, you know the force on that car. So the windshield broke and the front end of the car was all crashed in. And amazingly, the airbags came out and everything, but I thought that I was fine. I looked and my hand was kind of getting red and it was swelling up a little bit. And the ambulance came and they asked me, the paramedics asked me if I wanted to go to the hospital. And I was thinking about it because I thought, well, I have a flight the next morning to come back to San Antonio at 7 a.m. and it's already about 11:30 or so. And, you know, do I really want to go to the hospital? And I thought, well, you know, if I have to end up going to the doctor in San Antonio, then I want to document that I had some problem and maybe I broke a bone in my hand or something, and I'll go to the hospital for 15 minutes and they'll do an x-ray and then I'll go on my way. So I get to the hospital. I get to the hospital somewhere outside of Bilbao, Spain, and as soon as I get there, they put this neck brace on me That kind where you can't move your neck and it's all stiff, and they say, you know, we see these accidents on the road all the time, and even though you think nothing may be wrong with you, sometimes the pain sets in later, and you want to make sure that you catch it now. So they gave me something that I'd never had before because I've been pretty healthy throughout my life. They stuck me with an IV with contrast. For those of you that have gone to the doctor or the hospital, you've had an IV and they put the contrast in you so they can see what's going on with your organs. And they did that, and it took about 30 minutes, 45 minutes for them to do the MRI. And the doctor came back and they were gonna let me go, they were gonna release me. And I was anxious to get home because Ana and I have 3 kids, and now they're 11, 9, and my daughter, Ana Valentina, on May 2nd, next Friday, she turns 3. But my daughter at the time, that day, she had turned 2 months on July 2nd. And so the doctor comes, and then about 10 minutes later, the last thing they do at a hospital before they release you is they take the IV out, right? And they let you go. The doctor comes back, and there's a curtain around each of the patients. It wasn't in private rooms or anything. And she comes in and she closes the curtain. And then she comes over to me, and she's speaking in English and Spanish. And she says, my radiologist called me, and he believes that he sees 2 neuroendocrine tumors that have gone from your small intestine into your liver. And she was telling me that I had cancer. And in September of that year, I started getting a drug called lanreotide. And then in February of 2023, I had surgery at MD Anderson in Houston to remove, well, they took out all sorts of stuff in me. I left me with a huge scar, and I spent 10 days in Houston at MD Anderson. And I had to become an expert at insurance and things that I had never really had to think of before, and how much it cost, and I pay $1,300 a month for insurance now for me and my family. But here's the story. There was one line on this bill that stood out to me. It was the cost of that injection for lanreotide. The cost of that injection by itself, they were billing Blue Cross Blue Shield $24,000 every time I got that injection every month.
Wow.
So if you're somebody who has no health care coverage at all, or you're underinsured, you don't have Medicaid, you don't have the Affordable Care Act, or you don't have private insurance, and that's a lot of people in Texas, in the Rio Grande Valley, and in our country, then you're probably not going to get that shot. So I will always fight to protect people's health care.
Yes.
I believe that we need
Yes,
universal
yes.
health care in this country. We cannot cut Medicaid by $800 billion. It absolutely cannot happen for the people of this state and this country. And so I want y'all to think about the stories in your own lives where this policy matters. Thank you so much for joining us today for this conversation.
Thank you, Congressman. So, to kick off this conversation, we're going to go over some issues that we're dealing with to get into the policy, wonky, nitty-gritty of what's going on in Congress. We have what's coming up called a budget reconciliation vote. There's going to be, as we probably heard, cuts to Medicaid, to SNAP, which is a food safety program, to Pell Grants, so for those who have kids or grandkids that are about to graduate high school and going into college, or already in college and get those grants, they're making cuts to that as well. And so I kind of want to give you a rundown about what's going on here in the Valley and Congressional District 15, because we deserve to have that information. So let's talk about how Medicaid plays an important role in many people's lives. And Medicaid, right now, Texas as a state does not accept federal dollars to expand Medicaid to working class and low income people.
Where's Monica to tell us that?
I plead the fifth right now.
Mega Monica.
And so we're rejecting $11 billion a year, the state, rejecting $11 billion a year from the US government to get more people on Medicaid. And I know there's people in here or people out in the community that say, well, I'm not on Medicaid, that doesn't affect me. Well, yes, it does. Because whenever people who are uninsured or underinsured cannot get the health care that they need because of that situation, they're going to wait until their situation gets very dire and go to the emergency room to get care. And when they're in the emergency room, they're not able to pay. So that cost gets passed on to everyone else through $24,000 injections, through higher premiums. And so it's important that when we're talking about this, we're talking about this from a situation that everyone's going to be affected, whether you're on Medicaid or not. And so more than 200,000 district residents in Congressional District 15 rely on Medicaid for health care and protections against unaffordable medical bills, and they include 130,000 children and almost 25,000 adults aged 65 and older. This past year, Texas ranked #1 for 18 years in a row of having the highest uninsured children's rate in the country. And by double digits, by double percentage digits. At Unidos US, we have tried to work with Texas Health and Human Services Commission and the governor's office to address this. They're more focused on school vouchers and the wall, unfortunately. And so another issue, yes, absolutely. And so, many people with incomes who are considered too high for Medicaid buy their own health insurance on healthcare.gov. More than 140,000 district residents use premium tax credits to purchase coverage. So if Congress lets enhanced premium tax credits expire after 2025, these residents' healthcare costs, your healthcare costs, can increase by 152% on average. And so people are going to get hit with larger spikes. So Congressman, I don't know if you want to talk about the healthcare perspective of what you're hearing in Congress?
No, and Eric's right. Texas is one of a handful of states that never expanded Medicaid, even though we have the highest percentage of people that have no health care coverage at all, and the highest percentage of children that have no health care coverage at all. Governor Abbott and the Texas legislature have refused to expand Medicaid. And so now what you see is that our state and this country are on the verge of getting hit even more severely because the Republican majority, Republicans have the majority in Congress, and so the majority in Congress is considering legislation, what is called a reconciliation bill. And really quick, so you may be hearing that word, right? A reconciliation bill is simply a way to get around the 60 vote requirement in the Senate. Usually legislation needs 60 votes in the Senate, so as you can imagine, a lot of legislation never gets past the US Senate because it can't get 60 votes. So with reconciliation, this budget bill, it only needs 50 votes. So there are going to be 4 votes on this probably, at least 3, but probably 4. They've already passed 2 of them, the resolution part. The last 2 votes are going to be the specific amount of cuts to each of these programs. They're expected to vote on this on the week of May 19th or so in about 3 weeks. And some of the cuts that they're considering are hundreds of billions of dollars to cuts in Medicaid. Now, oftentimes we think of Medicaid as serving the poor or low-income folks, the kind of places where I grew up on the west side of San Antonio, those of you that are familiar with the San Antonio neighborhoods. And it's true that a lot of folks, low-income folks, are on Medicaid, but that's not all Medicaid covers. My grandmother, before the end of her life, was in long-term nursing care. She was there for a few years. So as many of you know, Medicaid is what is covering that long-term nursing care for folks. It also offers a lot of coverage for folks with disabilities as well. So there's millions and millions of Texans and Americans who are going to be deeply affected by these cuts if they go through. Those are some of the cuts in healthcare that are being considered. As y'all can imagine, there's cuts in a lot of different areas, in education with Pell Grants and other areas as well. But we wanted to focus a little bit first on these healthcare cuts, because in Texas especially, quite honestly, we're already in a bad spot. There's already a lot of people walking around suffering from different illnesses, whether it's diabetes, whether it's sickle cell, heart disease, cancer, different things where they absolutely need healthcare coverage. They don't have it now. A lot of people are underinsured, and the Congress is on the verge of making that situation even worse.
Thank you. Michael, what are you hearing on your end on the LUPE side? Y'all are very involved and entrenched in our communities. What are you hearing from about healthcare situations happening on y'all's end?
Yeah, so the Valley, and I know this isn't a surprise to anybody, the Rio Grande Valley has a large number of people who are enrolled in Medicaid and Medicare. I think at least here in the Rio Grande Valley, there's roughly 360,000 people who are enrolled in Medicaid, and then if you go just to Hidalgo, it's more than half. It's over 240,000 people who are enrolled. At the beginning, when this budget process was beginning, I think a lot of folks were hearing promises by the current administration, right? We're not going to cut Medicare. We're not going to cut Medicare. That's never going to happen. They're lying to you. They've been lying to us. They've been lying to residents in places like the Rio Grande Valley about what they are actually going to do with these bills. And, you know, you can look at the numbers. The